interested to know the type of doctor you saw. What type of doctor?
I think it's an oncologist.
Okay, so now, fantastic. So I work in a teaching hospital. We don't send patients to an oncologist unless you have a biopsy, core biopsy result.
But you hadn't had
because usually you start with a general surgeon. General surgeon will establish the fact that it is cancerous. And oncologist is not the first person. Based on the fact that you even said, the person said, it is not cancerous. No doctor will send you. That's why I'm interested to know the doctor. No doctor will send you to an oncologist with a non-malignant result.
Like I said, you go into the hospital, I noticed a lump on my boobs.
Was it Lagos or Enugu? Because
It was in Enugu.
Okay.
So I went into the hospital.
Was it a teaching hospital?
No, it wasn't a teaching hospital. It was a private hospital.
Okay, and it has an oncologist. That private hospital has an oncologist.
Let me explain.
Okay.
So walking into the hospital, you go to a normal doctor. I don't even know what they're called, but you went to a doctor, he examined, he found the lumps.
Okay.
That was when he said, let's do a biopsy. I don't know what a biopsy is.
Without an imaging?
No.
That's very strange.
No imaging because...
Is that possible?
It's not possible. It's not possible. Because biopsy is very invasive. Nobody will grab your breast and just do a biopsy without an imaging.
There was no imaging.
Was it the left breast or the right breast?
The left breast.
Okay.
Okay, so they didn't do an imaging, they just said go for a biopsy. It was when I went for the biopsy, it took about by
Was
then...
it painful?
What was the biopsy process like?
Yes, what was the process like?
Explain it to us.
I think they put in, I think they gave me a little, I don't know if it's anesthesia to like numb the pain a little bit. Then an incision close to the navel.
And what came out?
That's not the procedure. We don't do an incision.
I don't know what, but something went into my,
Okay, so
my results are
Are you
here.
saying that's false? It's not possible to...
No,
is
yeah,
that doable?
it's not. It's
Okay,
not sounding like a fine
what's-
needle. It's not sounding like a core biopsy. It's not sounding like a fine needle. We use a needle. It's a needle.
This one is like how do I put it? Why would you call it a machine? I don't know the right terms.
Oh, listen, you're
You
mixing
people are
things
using.
up. We don't use machine for biopsy as well.
That's
It's
what
an invasive procedure. We use a needle.
something
needle-
went into my boobs. They brought out some. I think they said
what part of your boobs? Was it
Exactly,
your
what type
nipple
of your
or was
boobs?
it...
The lump was found under my boobs. It moves sometimes. Sometimes it looks as if it beeps. And so I think around that place. I think they said they bring out. I don't know if there's particle of the lumps or thereabout. That's
With
what
a
they say.
machine?
Yeah, they took for the biopsy. I'm
With a
not.
machine.
Sorry, is
Maybe a
that's
pin.
No, it's
medically feasible?
No, it's a long needle.
Maybe
and
that's
it
what
has
I'm-
a trigger.
Okay, what's the
It's like
size
a
of the
mini
needle?
gun.
Wait, what's the size of the needle they used for you? If you're going to estimate it.
How do I?
Was it like 2
explain
inches
it?
long, 1 inch long? How was the needle?
I was lying down, so not like you're seeing exactly what is happening.
I find it very strange that you're mixing radiologists, oncologists. I feel like it's something you should know. It is.
No, it's not something I should know because cancer is not something I am aware about. I've said it
No,
over
but
and
you've
over
been
again.
given this. It's been 2 weeks since you came out to talk about this, and you mentioned stage 4. That was the first video I ever saw from you.
Yes, that was
stage
the-
4. How did they come about that stage 4?
I'm not supposed to know, so maybe at this
It
point
is
we're going
your
to be,
life.
that's what I'm trying to say. At this point, we're going to be asking the medical doctor. So